I'm Mary Krueger. I was there from 1991 to 1998, and I was the first coordinator director of health education. That's what it was called then.
I was a health educator. It was my first job in the field of higher education and health promotion. I worked primarily with the Peer Health Education program.
I took the job in '91. I was the whole department. It was just me at the beginning.
I started here at the campus and began seeing individual students who did some really good work with themselves in bringing down their risk, high-risk use of alcohol and other drugs. And I've continued with that for about 12 years.
We got 2 dorms for fall of 2004 to be smoke-free. Eventually all of the dorms and now the entire campus is smoke-free and tobacco-free. So that was a wonderful accomplishment.
Came on board as the director back in October of 2005. And we were a smaller unit then, about half the size we are now.
There was Fake Back the Night, and then there was Saga. So they united and they became ASAP. So working with that was really exciting. And I know that now they even have SAPA, which is another one. So it's very interesting to see how the organization's evolved.
Probably the largest expansion of outreach, along with a tremendous increase in numbers of clinical appointments, was during the time when we had Tara Schuster, who is our full-time health promotion specialist, who also ran the peer education program, also known as SHAPE.
My service to Emory began in 2006 when I was hired as a substance abuse counselor primarily in the Office of Health Promotion. At that point, for me, this was very much like stepping into a brand new world.
We really are focusing on a lot of prevention and wellness initiatives, particularly the Healthy Campus Coalition. And what I've seen in the past year is the number of students that want to come here and are looking for leadership opportunities.
I think that what's always been at the soul of health promotion for me at Emory is student engagement. Being able to come to campus and really work with student organizations.
Working here with health educators was really awesome and really inspiring to kind of continue working there.
One of my big projects was the National College Health Assessment, which I worked on with Mark Cordone and Kirsten Bondalapati, who is a graduate intern here at OHP. And we worked our tails off and got a record high response rate for the National College Health Assessment at Emory, which was almost 32%, which is sort of really revolutionary here. We did a great photo campaign, we got a lot of student involvement.
We were starting to shift a little bit from really clinical focus to doing a lot of policy work.
Over the course of the decade, the department has grown in size, but I think in focus as well. The department much more now is very much focused on community work, on prevention, on a more ecological type model, trying to build a healthy campus and a coalition of people committed to a healthy campus.
I remember my senior year, which was in 2008, Alexandra Vinson was working there, and she designed the logo that is still being used.
And one of the ways to keep the connection between the clinical providers and the health promotion department nice and vibrant was to have health promotion specialists come to the clinical provider meeting and have what we call the Health Education Minute.
I advise the Alliance for Sexual Assault Prevention and Sexual Assault Peer Advocates, which was just starting when I started, has been a really amazing experience for me. Seeing violence prevention and response at Emory as really for students, but also informed by students, has been incredibly important to me.
The evolution of addiction or alcohol treatment was to continue with the individual work, but also to include and move into something that was very prevention and health promotion oriented.
There's been an ever-increasing recognition of the relationship between wellness and academic success at Emory, and I'm really grateful to all of the people that collaborated on the President's task forces for alcohol and other drugs at Emory, and also for mental health at Emory, because out of those 2 task force reports, there were recommendations that really helped our department strengthen and grow in terms of personnel and programs and services and outreach to engage with our students around these important topics. And so I'm really grateful to everyone, students included, because in fact, students led the way on both of those initiatives, really saying, hey, this matters to us.
Health promotion really is a full 1/3 partner with our medical and nursing services and with our counseling and psychiatric services. And I hope that over the course of the past 10 years and over the 20 years of the success of this department, that each year they feel more and more an important part of this 3-part mission.
So I really developed some important relationships when I was there, and they remain important to me, and I have really good memories.
It catapulted my whole career, and I'm forever grateful, and I always tell people I feel so blessed that Emory gave me the chance.
I think one of the great learnings that I've had during my tenure here is being coddled and cajoled and encouraged and sometimes pushed into thinking less like a therapist and thinking more like an educator.
I've always really valued being a part of health promotion at Emory, and also a part of Emory Student Health and Counseling Services, because of the great relationships I have with colleagues here. I found them at all levels really supportive of my growth as a professional, very supportive of continuing education. I've been really honored to be a part of the American College Health Association's health promotion section and gaining a lot of new skills and new leadership on the national stage.
I've learned a whole lot from working with students, and students come in and I learn something new every single day, and that's pretty much what drives me to be in higher education, to be in wellness, to work in campus life.
Well, OHP has already kind of helped me gain a lot of confidence, particularly doing presentations, since I'm not completely familiar with that, as well as doing a lot of team meetings, because I've never done that really.
What I look forward to in health promotion and our future, which I think is bright, is continuing to build our work with interns and students, and also being able to really tackle some difficult issues on multiple levels.
But the things that have always been consistent as we've grown over the years are our deep respect and commitment to the students here, our interest in engaging students in changing the culture at Emory to be more health enhancing and health promoting, and our appreciation for what it means to be at Emory and to really support each other and be a strong team.
We don't really turn folks away. If you want to come in and you want to work on wellness initiatives, or you want to work on the Healthy Campus Coalition, you're looking for leadership opportunities, here's a place to come right now.
I'll be celebrating 15 years next July as a practitioner in the field of health promotion, and I couldn't have been happier to start our career at Emory.
I miss everyone, and I know Facebook just always catching up on what everybody's doing on the project. I just keep in touch with some of the students.
I look forward to seeing what they can accomplish in their second 20 years, and where we will be when the Office of Health Promotion celebrates its 40th birthday.
Happy 20th anniversary to the Office of Health Promotion.